teaching you how to do a maternal and a newborn assessment. This is a requirement and part of your clinical day when we're on mother-baby. Hi, Miss Jones. My name is Lori. I'm going to be taking care of your baby today. I just need to do an assessment. Would that be okay?
Yes.
All right. I'm going to just take a listen to them and make sure all the vital signs are good. All right. So I'm going to start. Normally you wouldn't talk to your patient, but I'm going to today. But normally we start and we do a head-to-toe assessment. Before we ever start the assessment, we start by an observation and looking at the baby and making sure that the baby's not in respiratory distress. This would include looking for circumoral cyanosis, which would be a blue coloring around the lip area of the baby, flaring of the nose when you're looking at the nose when they're breathing, or if you were looking at them underneath their blanket, looking for retractions in the chest and sternum area. We also look to make sure that they don't look like they're labored when they're breathing. If that all looks okay, then you can go ahead and start by counting respirations. If your baby's asleep, you can count it without having to listen with the stethoscope by placing your hand and watching for respirations for a full minute. After that, we want to go ahead and listen to the heart rate for a full minute with the stethoscope, and then also do a temperature. And you want to do them in that order so that you don't rouse the baby and make it angry and increase their respiratory rate and heart rate. After that, then we'd start with our head-to-toe assessment. So I'm going to sit this baby up. When you're assessing fontanelles, which would be one of the first things you do on your assessment, you want to sit it in an upright position. Assess the fontanelles. There's an anterior fontanelle. It should be diamond-shaped. It's a little bit bigger than the posterior fontanelle. It should be flat and soft. If it's elevated or if it's sunken, those are abnormalities that you would want to report to your nurse. If you follow the suture line back to the back of the baby's head around the crown of the baby's head, there should be a posterior fontanelle. It's diamond in shape, and it should be flat also and soft. After that, you can lay your baby down, and you're going to look at the baby, and you're going to look at the face for symmetry, making sure that everything looks like it's moving appropriately. After that, you're going to look and make sure that the ears look okay, which means you're going to look at the outer canthus of the eye, and make sure that the top of the ear lines up with the outer canthus of the eye. If they're low set, that's something that you would want to report to the nurse or your instructor. Also, when you're looking at the ears, you want to look at both sides and see if there is a tag or a pit, and that would be in this area here on the baby's ears. So look on both sides and make sure that you don't see that. If you do, that's an abnormality that needs to be reported also to your nurse. After that, you're going to blanch the skin on the nose over the bridge, assessing for jaundice, which would be a yellow coloring. You're also going to look in the eyes and make sure that the white part of the eye is not yellow in its coloring also. The other abnormality in the eye that you might have to assess for is bleeding, and that would be scleral hemorrhage. And that's an abnormality that doesn't necessarily need to be reported, but it definitely needs to be documented. It will go away on its own. Also, after that, then we're going to look and make sure that the mouth looks symmetrical in its movement. We're also going to put our finger inside of the mouth and assess for the baby's suck. We're also going to look for, by prying the mouth open, extra teeth or any Epstein pearls, which are little white dots in the roof of the mouth. Also, when we're assessing the suck, we're making sure that the palate is intact. Alright, after that, then you can unwrap your baby, because you want to keep your baby as warm as possible. You want to keep them wrapped as much as possible during your assessment, and then rewrap them following the assessment. Alright, once you get the baby unwrapped, then we're going to start with our stethoscope, and we're going to listen to this baby. Make sure you take all of the clothing off when you're doing the assessment, so that you can listen well. Okay. With your stethoscope, first of all, make sure that it's working by tapping on it and making sure you can hear. Go ahead and wipe it with an alcohol swab to make sure it's clean, and then make sure you warm it up in your hand before you use it. Listen in all 6 places on the chest, assessing for respiratory sounds. After that, then you can go on and listen to your heart sounds. You want to listen close to the nipple on the left side of the baby. And then you want to listen on the side of the chest also. This is the area that you might hear a murmur in the best. After you've listened to that, then you can move on to the abdominal sounds. You want to listen in all 4 quadrants for bowel sounds. You're also assessing the skin while you're looking at the baby and making sure that there's no cuts, no bruising, no abnormalities such as birthmarks. You're also going to look at the umbilical cord and make sure it's not draining any red bleeding or any yellow or green discharge that would indicate infection. After that, take a pair of gloves and put them on. Take the diaper down, and you're going to assess the genitals, just making sure that they look normal. This is a male baby. On male babies, you want to make sure that you look at the penis. You want to make sure that the urethra is at the very end and that that it is in the middle and not on top or below the penis, which would be abnormalities. We're going to also assess to make sure a testicle is in each scrotal sac. So we're going to push on the groin, start at the top, and work our way down, feeling for a testicle in each side of the baby's scrotum. If it's a female baby, you would just go ahead and assess and look for any abnormalities such as pseudomenstruation, which is bleeding, which is from mom's hormones, or any discharge that might be noted. After that, we're going to move on down and look at the extremities, making sure to assess for any Mongolian spots, bruising, making sure that the temperature is normal, the color is normal, and we're also going to do cap refill in the top of the foot, or you can do it on the fingers to assess for cap refill. Make sure that when you're assessing that you have all your bracelets on. There is a number on each bracelet, which you're going to match up with mom's bracelet. So mom will have a bracelet that matches baby's bracelet, and this is the number that you'll be looking for and matching up. The baby should also have a medical record bracelet on one of its ankles, and on the opposite ankle it will have a code alert bracelet, which is just a safety bracelet to make sure that the baby stays on the unit. If it's taken off the unit, it will alarm. So please stay away from the elevators if you're transporting the baby. Each time the baby's taken from the nursery back to mom, you need to make sure that you look at the bracelets because this is a red rule and could put you on for warning if you don't do so. Alright, you're going to take and flip your baby. You want to look at the back of the neck, and you're looking for telangiectatic nevi, or what we call stork bites. It's just red little spots on the back of the nape of the neck. Also, we're going to take and run our finger down the baby's back, assessing the spine to make sure it's intact. We're also going to look at the base of the spine where the gluteal fold starts, and we're going to look for sacral dimples. Sacral dimple is just an opening that can indicate that this baby might have spinal bifida. The next thing we're going to do is lay our baby flat, and we're going to assess the gluteal folds at the base of the bottom to make sure that they're even and symmetrical. This helps us assess if the hips are in joint. After that, you can take and flip your baby on its back, replace the diaper. Make sure you go and you document your findings in the computer. You're also going to make sure that you wrap the baby back up to help prevent hypothermia because they can't regulate their temperatures very well. Make sure the baby's wrapped in 2 blankets and that you replace the hat on the baby's head. Remember, you want to get the temperature with a thermometer, and you can do that after you've done your initial vital signs of respirations and heart rate, or you can wait till the end of your assessment and do it at the very end. Just make sure that you get those and document them in the computer also. And that would be it. Here's your baby. Internal assessment. We're going to start with the upper half of the patient, and then we're going to do the lower half. Alright, this is Mrs. Jones, and she's had a baby yesterday, and we're going to do her assessment. Mrs. Jones, how are you doing?
I'm doing good.
You feeling okay?
Mm-hmm.
How's your pain?
It's fine.
Are you having any pain anywhere?
No.